Alzheimer's disease is a neurodegenerative disease causing gradual loss of various abilities related to brain function. In other words, it's a progressive illness with the typical sequence of symptoms. There's an infinite number of stages of Alzheimer's disease because every passing day means that more brain cells are lost, and our ability to think is proportional to the number of functioning brain cells. Altogether, the time from diagnosis to terminal stages is anywhere from a few years to up to 15 years or even longer, but it depends on the patient's age at diagnosis, as well as other factors such as genetic background, concomitant illnesses, and mitigating strategies such as drug therapies. The most common early sign of Alzheimer's disease is persistent memory loss. Family members of people with early stages of dementia may notice increasingly frequent lapses in their loved one's communication and memory, especially with declarative memory or the memory of specific facts. These memory lapses can be specific to the person, called episodic memory, such as remembering your brother-in-law's name, or they can relate to commonly known information, what we call semantic memory, such as knowing who was the first president of the United States. Early stages of memory loss, manifesting as mild confusion with names, dates, and places, may last from months to years. Affected people don't retain information and frequently repeat themselves. They may forget to take their own medications. Over time, patients have increasing problems with attention and concentration, in addition to memory tasks. They may have trouble with visual spatial tasks. For example, they often become lost or disoriented in familiar places. They also experience difficulty with decision-making, or what we refer to as executive function. For example, either it may take them a long time to make trivial decisions, or they may make obviously poor choices. There can be compulsive behaviors, hallucinations, or other abnormal behavior. There are often changes in mood and sleeping patterns. These symptoms can be quite distressing, but fortunately many of them can be managed with medication. Many formerly easy tasks become increasingly difficult. People have difficulty driving a motor vehicle. They may have accidents or get pulled over by the police for erratic driving. They forget how to use the TV remote, the oven, the washing machine, or other tools. If a patient owns firearms or has other risky hobbies, it can be quite dangerous. As Alzheimer's disease progresses, people lose interest in all their former hobbies and interests, and both their language and reasoning ability are severely affected. As disease severity progresses, they become unable to perform basic self-care, such as dressing, bathing, and eating. At the terminal stages, patients are incontinent, nonverbal, and require full-time nursing care. Currently, there are only a handful of medications which are approved for Alzheimer's disease, and only one of them is what we call a disease-modifying medication. By this, I mean that it's been shown to change biomarkers of Alzheimer's disease and leads to relatively sustained clinical stabilization or mild improvement. The other currently available drug options may help slightly with attention or memory over a period of months, but don't influence the underlying disease. The good news is that there are a number of promising drugs in the pipeline, and there will be more options for patients in the coming years. I think that patients and their families know when something isn't right. However, they may have difficulty with the big picture view and require guidance in diagnosis and treatment options. It's important that they recognize the early warning signs and get to a neurologist before patients progress to later stages of disease. At that point, there's frequently little to be done aside from supportive care, but even then it's helpful to get an accurate diagnosis.